The biggest finding is that routine screening for depression, both in pregnancy and postpartum populations, actually reduces the prevalence of depression in these populations. So first of all, for years now, we have a routine screening process in place for all of our women who come into an OhioHealth facility and give birth to a baby. So after birth, in this postpartum population, a woman prior to leaving the hospital is given the EPDS scale, which is a depression screening scale, one of the ones that was actually looked at in this study. And it helps to identify anybody who might be at a higher risk for depression or someone who's already suffering from depression. At that point, the OB prior to discharge will look over this scale and many times we'll consult our behavioral health consultation team, at which time one of our psychiatrists or advanced practice nurses will go and evaluate the patient, determine what the diagnosis is, and if depression is something that's a problem in this patient, we will help to provide treatment options and help the patient to get linked with treatment on an outpatient basis or inpatient if necessary. But certainly red flag alerts for the difficulty of pregnancy crossing into an actual depressive episode that may require expert evaluation or treatment would be any kind of suicidal thoughts, hopelessness that's being expressed by the person, and really an inability to function, whether that be difficulty at work, difficulty with relationships. Is that depression is real. It's a brain disorder. It's much like if you had pneumonia, you would not recover from that pneumonia without the proper medication. With depression, especially when it becomes moderate or severe, and particularly when it starts to have psychotic components or suicidal components to it, these patients need to be treated. Their brains are not functioning properly. It's not their fault. I think oftentimes family members or friends who don't get it will say, just push on through or just suck it up. And when you have clinical depression, major depression, you can't do that. It's not possible without getting linked in with some type of treatment.